This report is structured on 9 pillars of the COVID-19 Strategic Preparedness and Response Plan. The PAHO Office for Barbados and the Eastern Caribbean countries activated its incident management team in February 2020. The office focused on 3 objectives: to save lives, protect health workers, and stop the spread of the virus. The incident management team visited Dominica, Grenada, St. Kitts and Nevis, and St. Vincent and the Grenadines to assess their capacity and provide technical assistance and training in response to readiness. Virtual meetings took place with senior health officials of the Ministries of Health to identify gaps, needs, and challenges requiring PAHO's technical cooperation. National plans in all areas of response were reviewed to assess potential public health measures. Over 20 webinars were hosted to engage young people, those living with NCDs, health professionals, and representatives of the hospitality industry. Videos, posters, flyers, and social media cards on key public health messages were produced and disseminated. Over 80 bulletins and situation updates on preparedness and response activities were produced and disseminated. High-level briefings were conducted for ministry officials, diplomatic community, media, and business groups. Countries and territories were introduced to the Go Data software for data capturing and analysis of the chain of transmission. They also received training on the mathematical modeling of COVID-19 cases. Entry protocols for the reopening of borders were reviewed and guidance provided to national health authorities. Infrastructure for case detection at points of entry was strengthened through the provision of equipment such as thermal imagers and IT tools for data collection at main airports. Countries were supported on readiness and response measures at ports of entry. A webinar on considerations for resuming non-essential travel in the Caribbean was organized. Government ministers participated. PAHO played a major role in the procurement of PCR machines, test kits, and accessories. Approximately 46,055 PCR kits, consumables, and other reagents have been procured. Laboratory capacity for PCR testing in Barbados and the Eastern Caribbean countries has increased from 2 in February to 7 at present. Many countries received training in methods of COVID-19 diagnostics. A webinar on scaling up laboratory testing in the Caribbean was successfully conducted. We facilitated infection prevention and control training sessions for over 750 health workers and personnel in the hospitality sector. Videos on the donning and doffing of personal protective equipment were produced. All countries were provided with personal protective equipment on an ongoing basis. Essential biomedical equipment was procured for countries. A webinar on the clinical management of COVID-19 focusing on experiences, challenges, and lessons learned was hosted. 187 persons participated. PAHO formed relationships with several international vendors to facilitate the procurement of medical supplies and equipment. The Barbados Defense Force and the Regional Security System of CARICOM are essential partners in the distribution of vital supplies and equipment. Personal protective equipment supplies are continually provided to member countries. A vaccination week in the Americas virtual campaign was held. Technical guidance, posters, and animated graphics containing key messages were provided. Consultations on school nutrition policy for Barbados was conducted. Anguilla was supported with a series of mental health and psychosocial support webinars. A Building Back Better Services webinar on non-communicable diseases was convened. St. Lucia was supported with the expansion of the HEARTS initiative to build back better NCD services. Overall, country preparedness, response, and coordination is enhanced. The spread of the virus is controlled. Health workers are protected by provision of training and essential supplies. capacity for testing, treatment, isolation, quarantine, and contact tracing enhanced. Countries are now able to open their borders, economy, workplaces, and schools safely. PAHO extends gratitude to international partners and governments for their financial support and collaboration. We are PAHO, and we care.